Hi there. So you got a little problem with pain and you're looking for some solutions? Let's talk about it. Hi, my name is Dr. Rebecca Gustafson and I am a naturopathic doctor. I've been working with complex pain patterns for quite a while now and have developed a comprehensive approach to help manage pain problems. Physical pain can set up in the body in many ways, whether the pain is acute or chronic or systemic, which could be full body pain, or localized, maybe just a couple areas where the pain pattern set up. The comprehensive holistic approach helps to support the whole body and the whole body to begin its healing journey. When a patient comes into the office, I do a full intake, and this includes a pertinent physical medical exam along with that. We discuss your labs and we discuss your imaging. As a naturopathic doctor, I'm not opposed to pain medication. There is a time and a place. Do I want you on pain medication? No. Is it appropriate sometimes? Yeah, it is. Is the final outcome to have you on those? No, we want to get you to a point where you don't need them. We want to get you to a point where the body is healed enough and you don't need me or another doctor, and you don't need any medications to support you. Pain can come from a lot of areas. Pain can come from motor vehicle accidents, sports injuries, and it can come from various illnesses. For instance, Lyme can cause full body pain patterns. Also, pain can build upon itself. For instance, you've been in a motor vehicle accident and you're not moving as well as you used to. It hurts too much to work out. So gain a little bit of weight. This adds to the problem. Then maybe a little bit of junk food, and that junk food adds inflammation to the chronic pain pattern, and it can build upon itself over time. So when I talk about comprehensive, that's part of the reason I talk about it like this, because we need to address the diet and why it is causing the inflammation in the first place, right? So we have to unwind a little bit to get to the point where we can address all the issues. I often look at lab findings that are outside of mainstream medicine, and this may include heavy metals. For instance, I've seen heavy metals cause pain patterns that can happen from a low immune function. So the immune system drops from the heavy metal issue in the body, and then what can happen next is a disease state can set up in the body, and this can cause systemic pain also. So another thing that's very important is to discuss stress levels. And the reason why I talk about lifestyle is stress levels can cause high cortisol. If you've gone to a doctor and had an adjustment, and the adjustment only holds a little while, maybe a day or two, and you go back and you get another adjustment and it holds a day or two, and you go back and you get another adjustment and the adjustment just doesn't hold. If you have a lot of stress and then you have a high cortisol level, this can cause stress to the adrenal glands. When your adrenal glands are stressed with that high cortisol level, your sleep pattern can be interrupted and this can cause problems. And then also, when you have that, the ligament laxity can set in, right? Ligament laxity is your structure is not staying in alignment because the ligaments aren't set well. The work I do involves different techniques, including myofascial release, trigger point work. You know when you hit a trigger point. You feel alive when you hit a trigger point. I've had the work done. It can be pretty intense. I use applied kinesiology. It is important to get that body into a good structural alignment. I also use regenerative joint injections, and those injections can include PRP, prolotherapy, prolozone, and now really cool stuff, neurotherapy and stem cells. Stem cells are coming out lately and they're amazing. So again, when I talk about comprehensive approach, I'm talking about a comprehensive approach to the problem, how it happened, and to how to solve the problem. I will be doing some more videos on some of the modalities I talked about. For the example, the injection protocols, I'll talk about a little bit more about those, maybe on prolozone, and then of course we'll talk a little bit about diet and other videos. So please like, share, and subscribe, and I will talk to you soon. Thank you.